This is Rick Cates, and this chapter is on organization and regulation and behavior. I think Rafat is going to cover most of this material, but it's the start of the week, so at this point you've got 3 chapters for this one, 10 and 11 and 12. So if you think about it, you had all weekend to read this material, and as far as the reading goes, I mean, basically it's an online course, so should be putting 2.5 hours per day reading. So let's go ahead and get started. You've probably already read through the PowerPoint presentation. We'll abbreviate that a little bit, and we'll do the power of 3. And let's go ahead and get started. Okay, so the power of 3 this week, they're real original this week. It's just using the words from the chapter. So you've got the organization, you got regulation, and individual behavior. Hey, Rafat, get your happy self over here.
Don't be so grumpy. Here are the 5 control knobs for health sector reform.
Oh, Dr. Salim's knobs again, huh, Rafat?
Yes, we did the first 2 last week, finance and payment. Now we'll cover the last 3.
Which way are you going to turn those knobs, clockwise or counterclockwise, Rafat?
Anyway, you turn them. Don't be so grumpy, man. We'll be done with these knobs today.
What are you talking about? I'm not dancing around like you listen to the happy song. Alright, let's get serious and go through the material.
The first knob is organization, and organization refers to both the overall structure of the healthcare system and the individual institutions of the system which provide healthcare services.
Rafat, you gonna tell them a little bit about your joke, like, hey, take a ticket?
It's about going to China for healthcare services, kind of medical tourism thing.
Really funny, Rafat. Not.
There are many kind of organizations in healthcare system, as well as there are different activities to be done within the organizations.
Okay, make sure you touch on the interaction, like where the organizations share resources.
Now in terms of ACA, there is accountable care organization, there is the vertical integration thing is coming up, and especially the allocation of resources within this organization is very important. There are 3 kind of strategies for organizing healthcare system and organizations within the healthcare system. First one is who does what.
Rafat, let's pick up the pace, man. They had all weekend to read this. Public or private?
And then incentives.
Efficiency, quality, etc.
And the last one is managerial improvements within the organization. So the keys to organizational performance depends on these incentives to the organization, and incentives to the managers also, and incentives to the workers. And then comes the skills and attitudes of managers and workers. And to put all these things together to manage the organization, managers should have the authority.
Did you touch base on internal and versus external incentives?
Right, external incentives are those coming from outside, from the government or any kind of organization, and internal incentives is from organization to its managers and workers.
Bonuses, for example.
Yeah, bonuses and performance
gotcha.
bonus. Yeah.
Changing. Who does what? We've already talked a little bit about this.
Right, private organizations, public organizations, quasi-public organizations do their work in different manners, and their scales. Economies of scales means increasing the size of the organization may bear some benefits or may bear some losses. Then there is these economies, and the scope is the increasing the number of tasks done by the organization. That is economies of scope.
Incentive strategies. I think the advantages outweigh the disadvantages.
Right, the incentives have advantages like it increases technical efficiency and quality and decreases cost, but the disadvantages is that healthcare is a different type of commodity which cannot be sold in a competitive market. That's why the health market for healthcare may fail and incentive strategy may not work.
Right, very different than consumer goods. Managerial interventions.
So decentralization of the administrative power to the local authority, or maybe absolute transfer of authority to the local authority, that is called devolution or deconcentration, and corporatization of the public or quasi-public organizations like public companies and private companies.
Right, you've moved it from a government entity to a private.
To achieve more efficiency.
Exactly. These are some of the requirements or attributes for a successful reform.
Right. Apart from design and implementation, you can see that good management is very very important, because managers are going to implement those designs. So management is pivotal here.
Well, we've talked a little bit about this in terms of like accelerating change. You find your naysayers, you win them over, you get everybody involved to help facilitate change within an organization. In sum, I'm sure they meant in summary or in conclusion, so maybe we get to turn this knob off and turn another exciting knob on.
Right. For organization, managers are very crucial for effective functioning of an organization. And besides, in the policy level, there is a broad overview of policy, but the detailed implementation is done by the manager, and detailing is very important.
All right, well, that's one chapter done. Looks like we've got another 2 more to go, and probably another, looks like 62, maybe 82 slides Rafat has here.
Right.
Let's go. Let's move on.
Yeah, for let's say the next one is regulation, and regulation can be of different types, like for providing care, financing healthcare, or who are producing inputs for the healthcare, like healthcare professionals, and their education, regulating their education, like regulating medical or dental education in the country.
So, allocation of resources, we've already talked a little bit about this. It's the most effective or most efficient way to allocate resources based on need, merit, money. This is where you might create a matrix to figure out the best way to supply or use limited resources that you may have.
And there are two allocation methods. One is, you can see the managed allocation, that is by government, and another one is market allocation, that is laissez-faire type of economy. In the invisible hand of market will do the allocation.
Would have been a nice slide with an invisible hand. The strengths and the weaknesses.
Maybe this would have been a very good slide image for power of 3, showing you as a weakness and me as a strength.
Yeah, right.
And now the managed allocation have strengths of itself, that it can market all those resources that those goods don't have any market, like public goods, and those should be allocated upon need-based allocation, and those goods cannot be marketed in an open market, that is organs. Kidney cannot be sold in the open market. So managed care allocation has their own strengths for this kind of public or prohibited unacceptable goods.
It's getting pretty deep when they get into slavery and harvesting organs, huh? That's not something to laugh about, Rafat. Alright, so you got the weaknesses, Rafat.
Right, managed allocation have its own weaknesses. Often it may be inefficient and more costly, and from its top-down approach, when it comes from the center, the local authority cannot take it quickly, or it is not flexible, it is not innovative, and it may be seen as paternalistic, and it increases the corruption and nepotism.
Yeah, like promoting Rafat to the manager or something.
No, Rick.
Okay, strengths, Stickman.
Market allocation can be efficient, and it can generate innovation through rewarding the innovation process, and thus it can produce high quality products and services, and in the same time it can lower costs through competitive processes.
Alright, this one talks a little bit about weaknesses of market allocations.
Right, so for public goods and for organs or for slavery, you cannot have any market. So that's the one thing there, you should have this managed allocation. And in a competitive market, objective is to gain the profit, to win, and we can see that monopoly is there, so which destroys the market. So oftentimes, and for some specific kind of goods, you cannot have market allocation.
Alright, quickly, Rafat, what are some of your solutions?
So the solution is really that it should be mixed type of allocation. Market allocation for marketable goods, and managed allocation for public goods and prohibited goods like organs. And quasi-public institutions can employ both market and managed type of allocation in the healthcare sector.
Okay. And you got, your regulations, think about government regulations, antitrust laws to control, monopolistic practices. Okay, this slide brings into consideration some of the issues with regulations and reasons for market failures.
Right. Health is a unique commodity, as we have said, that it has information asymmetry between the patient and the provider. When provider knows better, and they should have to inform the patients about their choices and the options, and the bias that the patients should be able to judge the quality. So input processes outcomes that should be known or informed to the patients. And supply induced demand, we already know that physician has the authority and power that they can induce some kind of demand and they can prescribe more drugs or tests. And to counteract the monopolistic system is bound to happen here, because there's different kind of information, different type of services are provided by different type of providers. So regulation should be there also to counteract monopoly.
All right, let's pick up the pace, Rafat. We got behaviors, design, implementation, evaluation. This chapter is broken into categories. You've got treatment-seeking behaviors, health professional behaviors, patient compliance behaviors, lifestyle and prevention behaviors.
And you can see that the health professional behavior is on the part of the providers, and other three, treatment-seeking, patient compliance, and lifestyle and prevention behaviors, are on the part of the patients. There are different approaches to change individual behavior. You can see that it is a continuum of from least coercion to most coercion, and information is the least coercive method, that you can give information to anybody and it is up to them to take that or not. But prohibition by law is most coercive, and you have to abide by the law.
All right, Rafat, this is patient seeking, treatment.
Right. So these treatment-seeking behaviors tells us that when the patients goes where, to whom for their services, and it also depends on the having insurance or not, and also it has different facets. It is the kind of health professional, where you're going to the primary care physician or the secondary care, or the timing and location. You are going nearby hospitals or going to the other town or big town for your treatment, or you are going to the traditional or more sophisticated type of medicine practitioners.
Rafat, that would have been a good opportunity to talk about your little cartoon earlier. Okay, these are some of the health professional behaviors.
Right, providers has their own behavior on making decision on treatments, and they can stick to their practice guidelines, or they have different amount of attention given to the preventative care and the location of treatment, whether it is a public hospital or provider's own private chamber, or referral of patients there. That is very important, when they refer and how, at what condition they refer the patients to other providers.
Rafat, what do you think about these last two slides and explaining behavior and using that as a question type for the next quiz?
Maybe.
See what I'm saying? This might be another good one for some questions. Patient compliance behaviors.
Right, patient compliance or adherence to the medication or the treatment plan is very important, and nowadays got lots of attention, and it's mainly talked about the pharmaceutical prescriptions or pursuing referrals or any other kind of treatment following behaviors. Even it can be done with the tobacco cessation techniques or behaviors or
right. So if people people need to take their medicine, especially if they've got a chronic disease, think about diabetes. If they don't, then that we incur additional costs. Good call, Rafat, on the tobacco comment, because we're talking about lifestyle and prevention behaviors.
Right, risky lifestyles like tobacco smoking or diet or less physical exertion you are doing is very much important for these non-communicable diseases like cancer, diabetes, and heart diseases. So it is very much important for public health professionals that prevention is better than cure, and for prevention purposes you have to change your lifestyles, and it is changing lifestyle behaviors is very much in the middle of public health discussion.
All right, social marketing, like Facebook. You never know what you're going to see on Facebook. You may have, something that discusses behavioral changes.
Right, social networking is a very potent site, and you can see there are 4 P's for marketing: product, place, price, promotion. So Facebook can be a place for you marketing your product, and your product should have price and it should be promoted like advertisement.
Exactly. That's kind of marketing 101, those 4Ps. So, Rafat, what are some of the problems and challenges facing social media and getting your message across to the right people at the right time, at the right place?
Right, the name implies that social marketing is some you are marketing your product, here obviously health product, to a community, a society. So you have to analyze your market first, to whom you are providing, and do this market have segmentation problem, and there are different types of buyers like rich people, poor people, to whom you are uh, offering your product. So you should have your own product strategy, pricing strategy depending on the buyer's ability or affordability, and you have to have your own strategy for channeling through the product to whom or through whom you are passing these products. And communication strategy, we have already told about that, advertising your product to the right kind of audience.
All right, that's the end. Good job, Rafat.
Thank you, Rick.
See ya.
See you.